Hello, my name is Mikala Roche. I am a dietetic intern with Gourmet Dining, and today I'm going to be talking about food assistance programs and how to utilize them. Food assistance programs are programs that are created typically to help those with low income by providing a way for them to have access to nutritious foods. In this slide, I will discuss three common categories of programs. First, child nutrition programs. There are several programs that are created to help children. Some of the most common include the National School Lunch Program, the School Breakfast Program, and Farm to School. Child nutrition programs help to ensure that children have access to nutritious meals and snacks in schools, summer programs, child care centers, and after-school programs. The National School Lunch Program was established under the National School Lunch Act signed by President Harry Truman in 1946. It is a federally assisted meal program operating schools and child care centers. It provides nutritionally balanced, low-cost, or free lunches to children. The School Breakfast Program provides reimbursement to states to operate nonprofit programs in schools and residential child care institutions. The Patrick Leahy Farm to School program helps child nutrition program operators incorporate local foods. The next category is food distribution programs. Food distribution programs aim to nourish people in need and support American agriculture. Some of these programs are the Emergency Food Assistance Program, Commodity Supplemental Food Program, and Food Distribution Program on Indian reservations. First, the Emergency Food Assistance Program is a federal program that helps supplement the diets of people with low income by providing them with emergency food assistance at no costs. The USDA provides 100% American-grown USDA foods and administrative funds to states to operate the Emergency Food Assistance Program. The Commodity Supplemental Food Program works to improve the health of low-income people at least 60 years of age by supplementing their diets with nutritious USDA foods. USDA distributes both food and administrative funds to participating states and Indian tribal organizations to operate the Commodity Supplemental Food Program. The Food Distribution Program on Indian reservations provides USDA foods to income-eligible households living on Indian reservations and to Native American households residing in designated areas near reservations or in Oklahoma. The USDA distributes both food and administrative funds to participating Indian tribal organizations and state agencies to operate this program. Finally, there are also nutrition programs designated for seniors. These programs focus on the needs of older Americans aged 60 and over and include the Senior Farmers Market Nutrition Program, Meals on Wheels, and the Older Americans Act Nutrition Programs Fact Sheet. The Senior Farmer Market Nutrition Program is designed to provide low-income seniors with access to locally grown produce. Next, Meals on Wheels is a food delivery service for seniors. It operates all over America. Finally, the Older Americans Act Nutrition Programs Fact Sheet is useful to help understand the programs at greater detail. The intent is to make community-based nutrition services available to older adults who may be at risk of losing their independence and their ability to remain in the community. There are many more programs available, however, these are several of the more popular ones. You can learn more about these programs and more at nutrition.gov. Next, I'm going to cover two of the most popular programs and a little bit about them. The USDA's Food and Nutrition Service works to end hunger and obesity through the administration of 15 federal nutrition assistance programs, including WIC, SNAP, and school meals. The first one, which is the most common, is SNAP. This is the Supplemental Nutrition Assistance Program, which provides nutrition benefits to supplement the food budget of needy families so they can purchase healthy food and move towards self-sufficiency. SNAP is a federal program that provides nutrition benefits to low-income individuals and families that are used at stores to purchase food. The program is administered by the USD Food and Nutrition Service through its nationwide network. The next program is WIC, Women, Infants, and Children. WIC safeguards the health of low-income women, infants, and children up to age 5 by providing supplemental foods, nutrition education, and health care referrals. The foods provided through the WIC program are designed to supplement participants' diets with specific nutrients. The program is available in all 50 states, 33 Indian tribal organizations, and more. It is funded through grants from the federal government. WIC is administered by 89 state agencies with services provided at a variety of clinic locations. It is important to know who qualifies for these programs and how to qualify. I will be discussing the qualifications for SNAP and WIC as I feel they are the most relevant to college students. However, to learn more about the qualifications of other programs, visit nutrition.gov. It is important to note that, however, generally students ages 18 through 49 who are enrolled in college at least half time are not eligible for SNAP unless they meet certain specific requirements. To begin with, for SNAP benefits, your household must meet certain requirements. If your state agency determines that you are eligible to receive SNAP benefits, you will receive them back to the date you submitted your application. There is an application process for SNAP, and applications are specific to the state where you currently live. Because each state has a different application form and process, a member of your household must contact your state agency directly to apply. You can contact your state agency by visiting your local SNAP office, visiting your state agency's website, or calling your state's toll-free SNAP information hotline. Some states have online applications that can be completed from the state agency website. In the center is a table that shows the household size and maximum allowable income for that household size to qualify. WIC is for pregnant, postpartum, and breastfeeding women, infants, and children up to age 5 who also meet certain requirements. These requirements include income eligibility and state residency. Additionally, the applicant must be individually determined to be at nutrition risk by a health professional or a trained health official. Two major types of nutrition risks are recognized for WIC eligibility: medically based risks such as anemia, underweight, history of pregnancy complications, or poor pregnancy outcomes, and dietary risks such as inappropriate nutrition or feeding practices or failure to meet the current dietary guidelines for Americans. Women, infants, and children at nutrition risk have a much greater risk of experiencing health problems. In this slide, I will be talking about the specific benefits that you can get from being a part of some of these programs. If you are found eligible, you will receive SNAP benefits on an electric benefit transfer or EBT card, which works like a debit card. Benefits are automatically loaded into your account each month. You can use your EBT card to buy groceries at authorized food stores and retailers. The total amount of SNAP benefits your household gets each month is called an allotment. Because SNAP households are expected to spend about 30% of their own resources on food, your allotment is calculated by multiplying your household's net monthly income by 0.3 and subtracting the result from the maximum monthly allotment for your household size. In the table below, there is an example of benefit computation. WIC benefits are not limited only to food. Participants have access to a number of resources including health screening, nutrition and breastfeeding counseling, immunization screening and referral, substance abuse referral, and more. The foods provided through the WIC program are designed to supplement participants' diets with specific nutrients. WIC authorized foods include infant cereal, baby foods, iron-fortified adult cereal, fruits and vegetables, vitamin C, rich fruit or vegetable juice, eggs, milk, cheese, tofu, peanut butter, dried and canned beans, canned fish, whole wheat bread, and other whole grain options, and more. For infants of women who do not fully breastfeed, WIC provides iron-fortified infant formula. Special infant formulas and medical foods may also be provided if medically indicated. On the slide, there are some helpful links and resources about each of these programs, how to utilize them, qualifications, eligibility, and benefits. Here are my references that I used to compile this presentation and get all my information. Thank you so much for listening.